Friends, I am Dr. Sujit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 8 Homeopathic Remedies for Morning Sickness. What is morning sickness? Nausea and vomiting felt mainly in the morning by pregnant ladies during first few months is known as morning sickness. Generally, it starts about 6th to 7th week of pregnancy and ceases in second trimester. Second trimester means 3rd to 26th week. This period is called second trimester. About 7 in 10 ladies suffer from this trouble. But this is very much common. Very much common. Is morning sickness dangerous for the baby in the womb? Usually morning sickness goes away with time and does not cause any danger to the baby or to the mother, unless some grave situation like Hyperemesis Gravidarum is there. Hyperemesis Gravidarum is a serious condition. I will discuss this later on. What is the cause of morning sickness? The true cause is not known. However, few factors are assumed to play behind. The factors are, look down on the right side below, a pamphlet has been given. Morning sickness causes. Causes means that factors. Certain odors. Certain odors means it is specific to the person. Certain foods also specific to the patient. Fatigue. Emotion, distress and anxiety, common. Fatigue, common. Vitamin and mineral deficiency, common. Bearing multiple children, that is another factor. What is Hyperemesis Gravidarum? Excessive and extreme nausea, vomiting during pregnancy is called Hyperemesis Gravidarum. It is almost uncontrollable. About 3 in 100 women may suffer from this. It causes the affected one to lose body weight and to be dehydrated, so that her health as well as the health of the baby in womb are at risk. It generally starts early in pregnancy, about early means any time in early pregnancy, and may run throughout the term. Constant medical supervision is required in such cases, because this disease is assumed to be a serious one. What are symptoms of Hyperemesis Gravidarum? Vomiting more than 3 to 4 times a day, dizziness and lightheadedness, symptoms of dehydration like thirst, dry mouth, scant urine, tachycardia, that is high rate of heart rate, that is pulse, low BP. What are risk factors of morning sickness? That is, who are affected much? First pregnancy, ladies with first pregnancy, pregnancy with multiple babies, had severe morning sickness last time means in this case the patient is probably in the later stage of, second or third stage of pregnancy. So first stage he had suffering, so he is amenable to suffering in the second, third time also. Have motion sickness or migraine. The lady is overweight. These are common risk factors. There may be other also. Can morning sickness be prevented? Yes. It is quite preventable. Try the following. Get appropriate tissue salts or vitamins daily as soon as pregnancy detected. Keep crackers, snacks near bed. Get a few before morning. Instead of 3 heavy meals a day, take 5 to 6 light meals a day. Take easy digestible light foods, avoiding high fat, oil and spices. Get snacks with high protein between meals. Get plenty of water, juicy fruits daily. Avoid foods and drinks that do not suit. Avoid smell that upset stomach. Now we are taking up remedies. Anacardium for morning sickness. Morning sickness with empty feeling in stomach, vomiting of ingesta. Ingesta means food taken, which gives relief. Nausea before and after eating. Feel better while eating. Weak digestion with fullness and distension of abdomen. Sulfur for morning sickness. In old cases, actually in old and stubborn cases, where well-selected remedy fails, single high potency dose often settles the problem. I mean, this is a curative stage, but the case must be obstinate one, old one. Generally, it is not given in the first stage, but if you know that your patient is a highly psoric patient, because he is a, maybe she is a old patient of yours, old patient, she is you are watching him for a pretty long time in past days, watched, so you know this is a highly psoric patient, then you can come to sulfur directly without any waiting. Otherwise, this is generally not given in the first stage. Netramure for morning sickness. Obstinate cases with loss of appetite and taste, but great hunger. Mind it here, hunger, appetite is something else. Appetite means eating tendency. Hunger, this is gnawing pain. Yes, I am hungry, but there is no appetite. It is quite possible. When I sit down to eat, I cannot take it. Heartburn after eating. Headache in morning on awaking with palpitations, dreams of robber in house. Getting up, true search made to find him. That is this patient, that Tamil patient. He or she dreams of robbers in the house. Then after rising from sleep, she or he really search around his or her home whether there is any robbers or not. Such is his tendency, or such feelings is there. Carbolic acid for morning sickness. Morning sickness with frantic headache and irritability. Nausea early morning with dull aching, uneasy feeling in the stomach. Mind this, morning sickness is fixed thing, nausea, vomiting, but you have to pick up remedies considering the other associated troubles. Say in the carbolic acid here, what morning sickness is there? There is frantic headache, there is irritability. These are additional symptoms, and this symptom will guide you to pick up carbolic acid. Because morning sickness is a fixed thing. Graphitis of morning sickness. Prolonged nausea in morning with anxiety. Mind this, anxiety is there. Chilliness, the patient is feeling chilly. Faintness, he is going to lose his sense. These are the guiding factors to select graphitis. Watery vomiting with salivation, constant spitting. Good appetite despite vomiting. Good appetite despite vomiting. Patient wants to take food, though vomiting is going on. Iodium for morning sickness. Obstinate, violent, incessant vomiting of food and bile. Note here, food and bile. This bile was not there in graphitis and other medicines. Preceded by nausea. However, appetite keeps up. Emaciation increase. The patient is already, iodium patient is emaciated patient. Actually, he is a cachectic body stature. This emaciation increases within a few days or in a week. Emaciation increases. Entim crude for morning sickness. Persistent vomiting with convulsions, not additional symptoms. Convulsion is there. Tongue milky white. Important symptom, tongue milky white. It is not there in other medicines. With eructation, testing of ingesta, it was there. Desire for acid drinks. Interesting. Desire for acid drinks. Derangement from overloading of stomach. Electric fur, Hyperemesis actually, for morning sickness. Obstinate vomiting during pregnancy with much debility. Excessive nausea and disgust for food. Least food causes distress in stomach. Attacks of fainting and with vertigo. These are additional symptoms which will guide you to take this electrics. Attacks of fainting with vertigo and constant sleepiness. These are the distinguishing symptom which guide you. Thanks for listening and viewing. Any problem, please write in the comment section. I will certainly respond.